morning. Myself, Dr Manisha Assistant Professor, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel, RPIIT Academics. If you like the content of this channel, please like, share and subscribe. Today I discuss about the cerebellum. Cerebellum, this is the hindbrain and located below the skull, below the occiput. Hypotonia, pendular reflexes, astasia, abasia, unable to stand or walk due to lack of motor coordination, unable to maintain a steady limb or body posture across multiple joints, ataxia, abnormal execution of multi-jointed voluntary movement, lack of coordination, inability to perform rapid alternate movement, dysdiadochokinesia, dysmetria, defective size of movement, intentional tremor, enable or switch on and off the agonist and antagonist, in coordinated movement during execution of movement, especially towards the end of movement, erroneous correction in the range of movement. Flocconodular lobe. This is the part of the cerebellum. Most primitive part, its cortex receives input directly from the primary. Vestibular afferents and somatosensori input from the neck, labyrinth and visual information project to the vestibular nuclei. Control, balance, vestibular reflexes and eye movement, vestibulocerebellum. The vermis and intermediate hemispheres. Vermis receives visual, auditory and vestibular as well as somatic sensory input from the head and proximal parts of the body. Vermis is the fastigial nucleus, cortex and brain stem medial descending systems that control proximal nucleus of the body and limbs. Vermis governs postures, locomotion and gait. The adjacent intermediate zone receives somatosensory input from the limbs and information from motor cortex. Intermediate zone, interpost nucleus, lateral corticospinous and rubrospinal and reticular system. Control the more distal muscles of the limb and digits. Lateral hemisphere, psychogenetically, most event receives input exclusively from the cerebral cortex association areas, cerebrocerebellum. Output through the dentate nucleus project to motor, premotor, parietal and prefrontal cortices. Cerebrocerebellum extensively involved in planning and mental rehearsal of complex motor actions. In the conscious assessment of movement errors role in cognitive functions other than motor planning, autism and schizophrenia. This is the diagram and in which show the lobes divisions of the cerebellum. There are the three lobes, anterior lobe, posterior lobe and the posterior is flocconodular lobe. And there is the three zones, vermis, intermediate zone, lateral zone or hemisphere. And also in which show the nucleus. Nucleus is dentate nucleus, emboliform nucleus, globus nucleus and fastigial nucleus.